everyone. I am Ayushi Banerjee, Assistant Professor in Department of Geology, Durgapur Government College, and I extend a very warm welcome to all of you joining us virtually today. We are gathered here for an awareness program on empowering youth by breaking the silence of understanding adolescent reproductive health education. This is organized by the Students' Health, Welfare and Psychological Counseling Cell under the institution's Innovation Council in collaboration with NSS Unit-I and Unit-II, Durgapur Government College. We are extremely pleased to be able to host this important session focusing on adolescent reproductive health, a topic that calls for greater awareness, empathy, and open discussion. We are also privileged to have with us Dr. Pooja Ganguly, our guest speaker for this evening. You will be hearing from her very shortly. With permission from our respected principal, sir, Dr. Devnath Palid, who actually encourages us to arrange such wonderful programs, we are actually, with his permission, starting this session. Uh, but I would like to invite Dr. Nivedita Acharjee, IQAC coordinator and president of Institutions Innovation Council, to share a few words with us. Ma'am, please.
Yeah, thank you, Professor Ayuti. Am I audible to you?
Yes, ma'am.
Okay, so it is really a great opportunity to get the invitation, a very positive issue, as I would say, the awareness program on empowering the youth by breaking the silence of adolescent and understanding the reproductive health education. Because as a higher education institution, I feel it is our responsibility for the holistic development of our students, not only their academic needs, but also their health, psychological needs and mental health issues, as well as their understanding of the health issues. So I'm very grateful to the Students' Health, Welfare and Psychological Counseling Cell and the NSS Units 1 and 2 for organizing this event. My sincere thanks goes to our resource person, Dr. Pooja, who has given her time for our students amidst her busy schedule. So thank you, Dr. Pooja, for helping us in, finding out the ways for the holistic development of our students. And for students, I would say that it is a good opportunity to hear from the person, a doctor, about a very important issue which needs concern in the present times. So, many thanks to all of you for arranging and inviting me. So, over to Professor Ayoti, and I wish very best to this event. Thank you.
Thank you, ma'am. Next, I request Dr. Pritha Goswami, Program Officer of NSS Unit 1 and 2, to kindly address the gathering. Dr. Goswami, please go ahead.
Okay, thank you, Aarti madam. Am I audible?
Yes.
Okay, okay. So, good morning, good evening, everyone. Respected principal, sir, IQAC coordinator, madam, respected resource person, my colleagues, and dear students. It gives me immense pleasure to welcome you all to this important awareness program. This initiative under the aegis of Institutions Innovative Council and jointly organized by the Students' Health, Welfare and Psychological Counseling Cell in collaboration with NSS Unit 1 and 2 of Durgapur Government College, marks a significant step towards equipping our youth with this knowledge and awareness that they truly deserve. Adolescence is a critical phase of life. We all have experienced it. We are experiencing it in our students. So, this is a time of rapid change, exploration, and self discovery. It is often shadowed by silence, stigma, and especially when it comes to reproductive health. So, we are really afraid to talk to our friends, talk to our seniors. So, today's program is all about these challenges, these silences, and we encourage you all to have a good dialogue with our resource person in the interactive session. This would foster a culture of openness, empathy, and scientific understanding. As an NSS program officer, I really believe that the power lies in the youth. Youth led change is very important. So, when our young minds are informed and empowered, they not only make better choices for themselves, but also become advocates for a healthier, more inclusive society. So, wishing the event a great success. Over to you, Ayuti ma'am.
Thank you, Preetha ma'am. Now we come to the most awaited part of today's event, the keynote address. We are honored to welcome our guest speaker, Dr. Pooja Ganguly. She's currently working as a senior resident general laparoscopy surgeon at Chatna Super Specialty Hospital. Dr. Ganguly is a dedicated professional who believes in the power of education to transform lives, especially when it comes to youth health and well being. A talk today titled Empowering Youth by Breaking the Silence of Understanding Adolescent Reproductive Health Education promises to be both insightful and thought provoking. Ma'am, it is a pleasure to have you with us today. The virtual stage is yours.
Hello, am I audible to everyone?
Yes.
Okay, so for good evening, everybody. Today we are going to discuss about the most important but least discussed part of in any biological healthy growth phase of human body. That is the okay. Please let me inform if any part of this discussion is am I not audible to everybody. Please inform. Okay. Thank you. So this is the adolescent period and the reproductive health period. Okay, so for this discussion, hello, I divided it into three parts. First part is the development part, that is the adolescent development, and then the reproduction period, and then the contraceptive part. Okay, so first we will discuss about the adolescent period. Now, what is adolescent? Adolescent, it is the term used for the pre-pubertal phase. Pre-pubertal phase, that is when a male or a female body just gain its physical development as well as the mental development towards sexuality. Okay, so this is in case of male, it is 11 to 18 years. In case of female, it is 11 to 15 years. Now, this adolescent period, why this is important? Because here there is some, from the biological part, there are some hormonal changes in the body, along with there are some external growth of the body which defines a person in the later life, and also its sexual behavior in the later life. Now here, what are the important things? First is the key to healthy development and safe practice in the youth and later life. Second is the use of contraceptives during this period, understanding the options to prevent pregnancy, that is the premature early pregnancies effectively, and also this is the period where we gain the all of the most important STIs. STIs is the sexually transmitted infection. Okay, so we can prevent all of this, that is the early pregnancies, the spread of STI, and also healthy mental development if we understand the adolescent period perfectly. Now, as I previously told, it is the critical growth phase, that is 10 to 19 years. It is the physical and the emotional changes the body undergoes during this period. And also, there are some sexual development, both internal organs, as well as the external organs. In case of male, that is the most external organs are developed during this period. In case of female, the external organs along with the internal organs, and the most important thing in case of female, that's the most of the girls during this period, they experience their first time of the reproductive age, system, that is the menstrual period, menstruation. During this time they first experience the menstruation, which is a very much important life event for every adolescent girls during this period, and understanding of that is very important for the her, along with her future spouse, for a healthy reproductive life. Now, what are the importance of reproductive health? It promotes the healthy development. It reduces the risk of STI, that is the most important thing, that is sexually transmitted infection like syphilis, gonorrhea. Although these infections are now abolished from the most of the part of the world, but most dreaded is the HIV. Till now we are facing with it, and the most of the STIs can be prevented with a proper reproductive care, and practice. Prevent early unintended pregnancies. Empower with knowledge and confidence. Now, what is menstruation? As I talked previously, it is the most important life event during the adolescence of every girl. What is menstruation? Menstruation, it is the cyclical bleeding event in every month in case of a girl student or a girl. Okay, now why this bleeding happen? The bleeding happen because after the maturation of the uterus and the ovaries, the internal sexual organs, the uterine wall, the endometrium, it prepares itself in every cycle for reception of a fertilized ova. Okay, now when in every cycle there is no fertilized ova, the endometrium lining of the uterine cavity shreds because of the disformation of it. Now it shreds with rupture of the vessels of the uterine wall, and it produces the menstrual product or the menstrual flow every month. That is why every month cyclically there is a bleeding episode of 3 to 4 days, maximum 7 days in every girl throughout their reproductive age. That is the reproductive age for nowadays. Nowadays it is extended. Nowadays about 15, age of the 15, early, there is early pubertal, early menarche. What is the menarche? Menarche is the first menstrual flow. And there is a late menopause. What is menopause? That is the stoppage of the menstrual cycle. It's about the age of 45 to 50 years. So during this period, every girl is fertile. That means they can carry a fertilized ova during this period. Okay, now this is what is menstrual. I clear about what is menstrual cycle. Now it prepares the body for pregnancy, begins at the age of 10 to 15, that is the pubertal onset of the menarche. It is a health indicator, signals a functioning reproductive system. That means the internal organs are receptive to to take a fertilized ova. Now, understanding fertility. What is fertility? Fertility of ability of any fertile female to conceive a children during this reproductive period. What is adolescent fertility? It begins with the physical maturity during puberty. During puberty, there are some hormonal changes which not only prepare the body, also it prepares the mind about the future perspective regarding their reproductive health. Okay, now what is the purpose? Purpose is helps in planning and preventing pregnancies. Now, basics of pregnancies. What is pregnancy? Pregnancy, it is the conceivement, or there is, or in medical term, it is talked as that is the implantation of a fertilized ova. Now female, they produces ova in every menstrual cycle. In the middle of menstrual cycle they produces ova, and in case of male they produces the sperm. Okay, now after mating, when the ova, when an ova, a sperm is mixed with the ova and it fertilizes the ova, it produces an zygote. Now this zygote, on implantation over the endometrial cavity, it produces a morula, or ultimately that produces a fetus. Now this is the cycle of pregnancy. Now why it is important? Now the sperm fertilizes an egg to cause a pregnancy, egg or ova. Why it is important? Because this is an onset of the menarche. If every female, they are capable for conceivement. Now our goal today, and also from the primitive, not very primitive, from the beginning of our learning about reproductive health, our aim is to produce or give some ideas of ideal ages or ideal body health, about when it is good for to take a pregnancy or good to continue a pregnancy. Okay, now it is said that early pregnancies, that is before the age of 18 or before the age of 15, it is very much detrimental to the health for the girl, or the or boys also, because it produces a burden to a pregnancy produces a burden to not only the health of the girl, but also it produces a mental burden to the girl and also the boys also. It is also very much detrimental health effect over the girl. So how we prevent the early pregnancies? First of all, use of contraceptions to avoid early and unplanned pregnancies. Awareness, understanding the process helps protect adolescent health. Now, what are the contraceptions? What is contraception? What is meaning of the contraception? Now, contraception meaning is it is used for prevention of any pregnancies. Okay. Now, beside this, first it is invented as to prevent pregnancies, but beside this there have many other health effect of contraceptions. What are those? First of all, it prevents the STI. Okay, next it regulates the hormonal changes during the menstrual cycle and also during pregnancies or unwanted pregnancies, and also many health it regulates the many other health effect in the body. So what are contraceptions? Like, there are different types. One are physical contraceptions, one are hormonal contraceptions. There are some permanent contraceptive methods. Now, what are the physical contraceptions? As we all aware of that physical contraceptions, one is condom. There are condom are two types. One is male condom and female condom. Mostly day-to-day life we used male condoms. Why? Because it is very comfortable to use. It is much more acceptable to the society, so compliance is good. Female condoms, they are less used, but they are as effective as male condoms. Okay, so there are some physical barriers. There are some anti-spermatic jellies. How they are used? When they are applied within the condoms or used with condoms, they are having the antibodies against the sperm. So whenever there is some intercourse, or there is some ejaculation, it destroyed the sperms on that semen. Okay, now this is how the contraception works. The jelly, the anti-spermatic jelly works. Now, what are the other good benefits of the condom? What are the other benefits? First of all, it prevents the STI, because it is a physical method. It prevents the STI. It is cheap, easily available to the market, and also it complies and compliance rate is good because the easily wearable and low cost. Third, it is most effective method. Okay, most effective method of contraception is a barrier method or the physical method. Okay, now this is male condom, female condom. Next, we are going to discuss about the hormonal contraception. What are the What are hormonal contraceptions? Hormonal contraceptions are the natural. They are the natural synthetic part of the natural hormones available in body. What they do, what they regulate the menstrual cycle or the hormonal balance in the body. That's how they prevent the contraception or the conceivement of the fertilized ovum. So without any knowledge about the hormonal imbalance in the hormonal balance in the body, the hormonal pills are not safe as the physical barrier methods. So most safest is the physical barrier method of contraception. Next is the hormonal pills. Hormonal pills, there are some emergency contraception pills which are used within 72 hours of any unprotected sex to prevent any unwanted pregnancies. Although these are associated with a very higher rate of failure, and also there is chances of transmission of any sexually transmitted infection, and there is severe bleeding in case of unauthorized use of hormonal contraception methods. Okay, so whenever anybody choosing any hormonal method of contraception, must be under the prescription of any knowledgeable doctor. Next, what are the other physical methods? Other physical methods is the intrauterine devices. Now, what are the intrauterine devices? Actually, the copper ion. You have to use the copper ion. The copper means the tama in our language, Bengali. The copper metal, it prevents the fertilization process and also the fertilization process and the implantation process. So, using this property of copper, we used it as an IUDs, intrauterine devices. Now, how it is placed in the uterus under sedation. Sedation means light anesthesia. We introduce this inside the uterine cavity of females. Now the copper ion within these intrauterine devices, it prevents the implantation process as well as the fertilization process. This is how the IUDs are act. Now IUDs are safe in case of long-term contraception, and also it reduces the risk of the cost. It is very much cost effective. Compliance is good. Okay, there are some permanent method of contraception which are called sterilization. What are the sterilization process? One is female sterilization, another is male sterilization. In case of female sterilization, what we do, we clips the fallopian tube of the female person. That's how the ova, it does not come into the uterine cavity. In case of male, what we do, it clips the vas deferens, that is the sperm containing vessel, sperm containing tract. We clip the vas deferens of a male to produces permanent sterilization in case of male. Okay, now contraception, they are safe, legal and widely available option. Birth control pills, hormonal method, prevents ovulation when take daily, effective high, but depends on the consistent use, and also always use according to the prescription or as prescribed. It is not over-the-counter drug. Disease prevention and health choice, it prevents physical barriers, they prevent the STIs, use condom consistently, get regular screening, informed choice, access reliable education, seek support from healthcare providers. Common myth about contraceptions: take pills or use devices exactly as directed by the instruction. Check expiry dates, use water-based lubricants only. And another important point is, if some condoms are mostly they are prepared from latex, that is rubber. So if anybody is latex allergy, they cannot use a condom. So everybody have to check about their allergic test before using a condom. Consult professionals, ask healthcare providers to find the best contraception method for you. Discuss about your choice, your need, and then choose from the umbrella of the contraception method, as discussed previously. Now, in case of female, another adolescent problem is the how to maintain the menstrual health, because menstrual health is important. Here, in every month, every cycle, we shed about 50 to 150 ml of blood, along with the threaded endometrial lining of the uterine cavity. Okay, now what are the menstrual hygiene? What are the menstrual product we can use? First of all, nowadays it is the sanitary napkins. We use the sanitary napkins that must be cotton based. Okay, next we use tampons. Now what are the tampons? They are also based on the cotton or some absorbent material. They are আচ্ছা, আমি কিছু জায়গায় একটু বাংলাতে ডিসকাস করে দিচ্ছি এই মেনস্ট্রুয়াল হাইজিনের জায়গাটা। মেনস্ট্রুয়াল হাইজিনের জায়গাটা বাংলাতে বলার কারণ, এটা আমাদের ডে টু ডে লাইফে, তোমার বা যে কোনো অ্যাডোলেসেন্ট গার্লের ডে টু ডে লাইফে খুবই একটা গুরুত্বপূর্ণ অংশ। প্রথম কথা, মেনস্ট্রুয়াল সাইকেল, মেনস্ট্রুয়াল জিনিস, মেনস্ট্রুয়াল ব্লাডটা কী? মেনস্ট্রুয়াল ব্লাড হচ্ছে এটা অ্যাবাউট 50 to 100 ml অফ ব্লাড প্রোডাক্ট। তার সাথে দ্য এন্ডোমেট্রিয়াল লাইনিং অফ দ্য ইউটেরাইন ক্যাভিটি, এটা প্রত্যেক মাসে ইট সাইকেল, যদি ওভাম ফার্টিলাইজ না হয় তাহলে ইট শ্রেডস উইথ দ্য ব্লাড। ঠিক আছে, সো ইট ইজ নট অনলি ব্লাড, ইট ইজ দ্য ব্লাড অ্যালং উইথ দ্য শ্রেডেড এন্ডোমেট্রিয়াল lining. So it is not always, color is not always great red or bright red. It may be darker black, darker red. It may be blackish sometime. Okay. না, মেনস্ট্রুয়াল হাইজিনের জন্য আমরা মেনস্ট্রুয়াল প্রোডাক্টস কী কী ইউজ করি ডে টু ডে, বা ডে টু ডে কী ধরনের প্রোডাক্ট ইউজ করা হয়। ফার্স্ট অফ অল, দ্য স্যানিটারি ন্যাপকিন। স্যানিটারি ন্যাপকিনস মোস্টলি যদি ভালো হয় যদি অ্যান্টি অ্যালার্জিক কটন বেসড স্যানিটারি ন্যাপকিনস ইউজ করা হয়, যেহেতু এটা ইটস এ ব্লাড প্রোডাক্ট, so there is always chance of growth of bacteria, mainly the staphylococcal infection. It is severe in case of menstrual pads. It is staphylococcal growth. To prevent that staphylococcal infections and other bacterial infection, there is always instructed to change a sanitary pad every 6 to 8 hours without independent of the flow rate. Okay, independent of the flow rate, you have to change a pad every 6 to 8 hours. Now other menstrual products like tampons. What are tampons? They are also cotton based elongated structures. Now how tampons are used? They deployed inside the vaginal cavity. And on soakage of the menstrual blood or menstrual flow, it soaks up, and reduce the mesa. Now, tampons are also must be changed every 4 to 6 hours to prevent staphylococcal or streptococcal infection. Next is the menstrual cup. Monohypous menstrual cup. Menstrual cup, they are also uh, rubber or latex made cup. Now they are pushed inside the vaginal cavity high up. Okay, this can be worn by both pubertal and after pregnancy as as a menstrual product. Now here the cup, takes all the it takes all the menstrual flow inside it, and after every 6 to 8 hours this cup need to be changed, and this cup can be reused after boiling it for 15 minutes. So these are reusable cups. Okay. Change regularly. Proper disposal of sanitary products safely and hygienically. Emotional and mental health in adolescent. Now, as I talked earlier, adolescent health not only it produces external changes, and the hormonal changes not only affect the external organs, it also affect the emotional buildup of a child, of a male or female child. Now, during this, we produces the sexual inclinity towards male towards female, and female toward males. So there are some hormonal changes. They influence the mood and behavior during adolescence. Common challenges affecting self-esteem and emotions. Talking openly helps managing emotional well-being effectively. Now, communication and consent. Consent, define what is consent. Consent, it is mutual agreement without pressure or fear, is essential. Importance in relationship, always respect boundaries, especially in case of any emotional context, or if there is any kind of uh, behavioral attraction towards any. It is normal to attract. It is always normal to attract a male towards a female and a female towards male. But this normal attraction needs to be discussed properly in both the ends, both in case of female end and also in case of male person. It should be mutual in from both the ends. Role of parents and educators. Safe space, create environments where questions are welcome, encourage honesty, promote open and truthful communication, guidance. It provides accurate reproductive health information and support. Seeking medical help when to visit for issue with menstruation, sexual health and contraception, regular checkups, prevent or catch health concern early through routine visits. Confidentiality, your privacy is always respected in medical appointments. Preventing early pregnancy. Education, awareness, access to contraception, daily sexual. Sorry. কি হলো? Sorry for the interruption. Education. So we are discussing early, how to prevent early pregnancies. Education and awareness, access to contraception, daily sexual activity, and empowerment. Community support and resources. Now, where we can, what are the places from where we input all these behavioral changes, and also how to develop some safe practices. Now, first step, it is the school, the sexual growth phase, the early sexual growth phase. We One second, okay. First of all, the school. At school level, the sex education and education about the sexual organs and developmental. What are the different development for both females and males? It is very important to introduce the first knowledge at the school level. There are some NGOs. They work on on spreading awarenesses, and also resources like providing safe sanitary napkins or some contraceptions like condoms to low socioeconomic groups and areas where the access to the minimal hygienic sexual products is reproductive products is less. Okay, there are some hotlines, like there are some helplines from the West Bengal government part, or the or the central government part, which helps in proper information about the need and what to do in certain conditions. There are there are doctors where we can seek helps if we are not knowledgeable. If one is not that knowledgeable or need helps, always seeks help for doctors or professionals in case of any emergency, or where you are confused about what to do in that period. Okay, so sexual development and mental development both goes hands by hands. We can't we can not only focus on the sexual external organ development, internal organ development, but also we need to talk about the mental development also. So there is a proper mental uh, suits for both male and female. Now, what are the summary? Somewhat each and every student, each and every person need to understand their own body, own self. What is their need? What is their sexual inclinity? What is their basic problems? Okay. Next, responsibility not only of yours but also your partner's responsibility is also on your shoulder when you are with someone. Support matters. The education, respect, and community aid keep adolescents healthy. Thank you. Now let us discuss if there is any query. Am I
Thank you
audible?
so Thank you so much, Dr. Ganguly, for such an informative and eye-opening session.
Okay.
Uh, be-
Thank you, students. If there is any query in any language, you can ask. I am very much free to answer any query regarding anything. Okay.
exactly. Thank you, Dr. Ganguly. Before we move forward, I would like to ask the audience if anyone has any question for our speaker. Please feel free to unmute yourself and ask. কেউ যদি বাংলায় জিজ্ঞেস করতে চাও তাও জিজ্ঞেস করতে পারো।
তোমাদের কারোর কোনো কোয়ারিজ থাকলে তোমরা সেটা এখানে শেয়ার বলতে পারো। Feel free to talk about everything. Okay, sexual health and adolescent health, it is a very critical phase of each student's life, so you can discuss it freely. Thank you. From with this I can end my discussion.
ফ্যাকাল্টি মেম্বারদের থেকেও যদি কেউ কোয়েশ্চেন করতে চান, কিছু জিজ্ঞাসা থাকে, তাহলে করতে পারেন। কারুর যদি কোনো কোয়েশ্চেন না থাকে তাহলে আমরা মুভ করব। With that, we move toward the conclusion of today's program. I now invite Anintha ma'am to kindly deliver the vote of thanks of behalf of our organizing team.
Good evening. Yes, this has been a very informative session on behalf of the awareness, on behalf of the Students' Health, Welfare and Psychological Counselling Cell under the institution's Innovation Council, Durgapur Government College. I extend my vote of thanks to Principal Sir Dr. Debnath Palit. Next, I'd like to thank IQAC Coordinator and President of Institution's Innovation Council, Dr. Nivedita Acharji. I'd also like to thank Program Officer of NSS Unit-I, Dr. Pritha Goswami, and my sincere gratitude towards resource person, Dr. Pooja Ganguly, who has taken time from her busy schedule for such an informative session. Thank you.
So we conclude our session for today. Have a great day ahead. Thank you.